Picture this. You're trying to catch a train, but there's a train broken down at the station ahead of yours. No trains are able to leave your station. More and more people are filling up the platform, and they're getting frustrated as they're unable to make it to work, so their businesses are unable to open for the day. This is similar to what happens when a patient has a stroke. The broken down train is the blockage, represented in this slide, and the people are the blood trying to get through to bring oxygen and nutrients to other parts of the brain. The longer the blockage occurs, the more tissue will die. Each year, 12.2 million people experience a stroke. Of those, 3.3 million will be fatal. Blockages are the most common cause of stroke, but they're the most difficult to visualize and diagnose based off current medical imaging protocols. Time is key in stroke diagnosis to optimize patient outcomes. The main drug used to treat a stroke must be administered within 3 hours of symptom onset. There are many obstacles that could lead to a patient having a delay in treatment. The first would be unknown time of onset, as this is defined by when a patient was last seen well. In cases where the patient was alone or asleep when symptoms started, this may be unknown. The second is bleeding within the brain. The drug used to treat a stroke will make any bleeding worse. A computed tomography, or CT scan, is taken to determine whether or not there's bleeding within the brain. This, however, does not confirm that there is a blockage or the regions impacted by the blockage. If this information is needed, such as in cases where the drug does not clear the blockage and surgery is required, an MRI scan must be taken. MRIs are better at imaging the actual brain tissue themselves. However, they're much more expensive, rarely available, and time-consuming. What if there was a way that we could get more information from these CT scans with just seconds of computation time? That is where my work comes in. I'm working on a dataset composed of CT scans taken at time of admission to hospital alongside follow-up MRI scans to be able to train an AI algorithm to pull out features from these CT scans, such as small changes in brightness. These small changes in brightness are virtually impossible for the human eye to consistently detect, but they could confirm for us that there is a blockage and the regions impacted by that blockage. Through the use of AI, we would be able to localize the blockage, quantify the damage, and restart the clock for stroke patients.